Hello everyone, let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Today we're gonna talk about part 1 of Fleischner Society 2024 Glossary of Terms for Thoracic Imaging. Let's go. Fleischner Society 2024 Glossary of Terms for Thoracic Imaging. This topic is for you who want to know the definition of and the radiographic CAT scan findings of thoracic diseases. Presented with love, Dr. Y. Radiology, reviews and commentary, statements and guidelines. Fleischner Society Glossary of Terms for Thoracic Imaging. Alexander A. Bankier et al. Radiology, Year 2024, Volume 310. Fleischner Society Glossary of Terms for Thoracic Imaging. Members of the Fleischner Society have compiled the glossary of terms for thoracic imaging that replaces previous glossaries published in 1984, 1996, and 2008, respectively. The impetus to update the previous version arose from multiple considerations. These include an awareness that new terms and concepts have emerged, others have become obsolete, and the usage of some terms has either changed or become inconsistent to a degree that warranted a new definition. This latest glossary is focused on terms of clinical importance and on those whose meaning may be perceived as vague or ambiguous. As with previous versions, the aim of the present glossary is to establish standardization of terminology for thoracic radiology and therapy, to facilitate communications between radiologists and other clinicians. Moreover, the present glossary aims to contribute to a more stringent use of terminology, increasingly required for structured reporting and accurate searches in large databases. Compared with the previous version, the number of the images, chest radiograph, CT, in the current version has substantially increased. The authors hope that this will enhance its educational and practical value. RSNA 2024. Achinus, plural, achini, anatomy. The achinus is a structural unit of the lung distal to the terminal bronchiole and is supplied by a first-order respiratory bronchiole with a diameter of approximately 4 to 8 mm. The secondary pulmonary lobule contains between 3 and 25 acini. Within the achinus, all parts are involved in gas exchange, i.e., they contain alveoli. The achinus consists of respiratory bronchioles, alveolar ducts, and alveoli. Normal achini are not visible radiologically, but the accumulation of pathologic material within achini may be seen as small, ill-defined, rounded opacities, sometimes called airspace nodules. Air bronchogram, pathology, and descriptor. Air bronchogram is the descriptive term for air-filled airways within lung parenchyma that is partially or completely airless. The term implies a patency of proximal airways and B, evacuation of alveolar air by means of absorption, e.g., in atelectasis or replacement, for example, fluid tumor, or a combination of these processes. Air bronchogram, pathology, descriptor. On your left side, the arrows indicate the air bronchogram of left lower lobe segmental bronchi in pneumonia patient. On your right side, the arrows indicate air bronchogram of right lower lobe segmental bronchi in pneumonia patients of CAT scan. Air crescent, pathology, descriptor. Air crescent is the descriptive term for a crescent-shaped air collection between the wall of a cavity and a mass within the cavity. It is often associated with the retraction of infarcted lung parenchyma in angio-invasive aspergillosis or with the colonization of pre-existing cavities by aspergillus or other fungi. In the latter case, the resulting fungus spore may be mobile and change position with changes in the patient's position. Air crescents can also occur due to necrotic tissue or a blood clot within a cavity. Air crescent pathology descriptor. The arrows indicate the air crescent in the mycetoma patients of underlying tuberculous cavity. Air trapping, physiology, pathology. Air trapping is retention of air in the lung parenchyma distal to more proximal obstruction of one or several airway. Air or gas trapping is seen at CT performed during or at end of expiration. It is characterized by a less than normal increase in attenuation and B, a less than normal decrease in volume on expiration. Air trapping should only be called on expiratory CT. Of note, areas of air trapping are typically sharply marginated. However, the distinction between air trapping and decreased attenuation due to vascular occlusion, in other words, in chronic thromboembolic disease, may be difficult. Air trapping is also frequently associated with decreased focal perfusion, in other words, caused by reactive vasoconstriction. Air trapping, physiology, pathology. Right side is expiration CT image. The arrows indicate the left lower lobe of lower density of air trapping. Air trapping. The arrows indicate both lower lobe of air trapping on expiration CAT scan. Air trapping. Black arrows of expiration CAT scan indicate left lower lobe air trapping. White arrows on right lower lobe indicate no air trapping on right lower lobe. Airspace anatomy. An airspace is the air, gas-containing part of the lung parenchyma, including the respiratory bronchioles, alveolar ducts, and alveoli, but excluding purely conductive airways, such as terminal bronchioles. The term is used in conjunction with opacity and nodule to designate the accumulation of material within airspace. Airways anatomy. The airways are structural parts of respiratory system that allow airflow. Conducting airways extend from the nares and buccal opening to the terminal bronchioles. Large airways include the cervical and thoracic part of the trachea, as well as the main, lobar, and segmental bronchi. Small airways include the subsegmental bronchi to bronchioles with an internal diameter of less than 2 mm. Diseases of central airways can often be visualized directly at CT, whereas diseases of the peripheral airways often manifest through indirect changes, for example, air trapping. Anatomic distribution, anatomy, bronchocentric, adjacent to or involved in bronchi and the axial interstitium. Centrilobular, centered on core structures of secondary pulmonary lobule, often used to describe distribution of nodules or micronodules. Diffuse, distributed throughout the lobe or lobes without particular regional predominance, i.e. between central and peripheral parts of the lung. Anatomic distribution, anatomy, centrilobular. The arrows indicate the centrilobular. This is hypersensitivity pneumonitis patient. Anatomic distribution, anatomy, centrilobular. The arrows indicate the centrilobular. This is non-tuberculous Mycobacterium pulmonary disease patient. Arrows indicate also centrilobular. This is tuberculosis patient. Another centrilobular, 3 in bud. The arrows indicate the centrilobular. This patient is infectious bronchiolitis. Anatomic distribution, anatomy, centrilobular. The arrows indicate centrilobular. This patient is diffuse panbronchiolitis. Last example of centrilobular. The arrows indicate the centrilobular. Anatomic distribution, anatomy, diffuse. We see diffuse ground glass opacity and consolidation of ARDS patient. Anatomic distribution, anatomy, endobronchial, located within lumen of a bronchus. Extrapleural, external to pleural without directly involving pleural or pleural space. Fissural, refers to a lesion or a disease that arises from or involves fissure. A lesion or disease that has direct contact with the fissure but does not arise from it should be called perifissural. Focal, confined to one distinct area. Geographic, distributed in a manner resembling the outline of regions on a map. The term implies well-defined margins between areas of differing attenuation. Anatomic distribution, anatomy, endobronchial. The arrows indicate the endobronchial hamartoma. Anatomic distribution, anatomy, extrapleural. The arrows indicate extrapleural fat. Anatomic distribution, anatomy, extrapleural. The arrows indicate rib origin tumor, extrapleural. Anatomic distribution, anatomy, fissural. Pleural metastasis of minor fissure. Anatomic distribution, anatomy, fissural. These micronodules are fissural, right major fissura, and they are also miliary micronodules of tuberculosis. Anatomic distribution, anatomy, perifissural. The arrow indicates perifissural nodule. Anatomic distribution, anatomy, geographic. The ground glass opacities are geographic in distribution. Anatomic distribution, anatomy, geographic. Bilateral ground glass of geographic distribution. Subscribed Thank you very much. Be healthy, wealthy, and happy. Anatomic distribution, anatomy, multifocal, involving two or more distinct areas. Peribronchovascular, distributed along the bronchovascular bundles. Perilobular, arcade-like or curvilinear opacities that can be related to the margins of secondary pulmonary lobules. Perilymphatic, distributed along lymphatic vessels. Anatomic distribution, anatomy, multifocal. Anatomic distribution, anatomy, peribronchovascular. Arrows indicate peribronchovascular. This patient is lymphangitic carcinomatosis. Another examples of peribronchovascular. These two patients are also lymphangitic carcinomatosis. Anatomic distribution, anatomy, perilymphatic. Arrows indicate the micronodules of a perilymphatic distribution. This patient is sarcoidosis. Anatomic distribution, anatomy, perilymphatic. The arrows indicate micronodules of perilymphatic distribution. This patient is co-workers pneumoconiosis. Arrows indicate the perilymphatic distribution of micronodules. This is another patient of pneumoconiosis. Anatomic distribution, anatomy, plural, refers to a lesion or disease that arises from or involves the pleura. A region or disease that has contact with pleura but does not arise from it should be called pleural-based. The term subpleural should only be used for lesions or diseases in proximity to pleura, but without direct contact to it. Because this term has been attributed variable meanings in literature, the term peripheral is preferred to describe such regions or diseases. Of note, imaging cannot always determine whether a given lesion is located between two layers of pleura or within pleura, or in parenchyma and directly contiguous to pleura. Anatomic distribution, anatomy, plural. The arrows indicate the plural. This lung cancer patient shows malignant pleural metastasis and effusion. Anatomic distribution, anatomy, plural. The arrows indicate pleural nodules of pleural metastasis. Anatomic distribution, pleural-based. The arrow indicates pleural-based focal lung collapse. From the Wikipedia, Primavera, the spring, Sandro Botticelli, 1470, Tempera on Panel, Uffizi, Florence, Italia. Quit smoking? Your great job of the year. Congratulations.